Today we're diving into the 12 key symptoms of ovarian cancer that you need to know about. Have you ever had that strange, persistent ache deep in your belly that you just couldn't quite place? Or what about that feeling of being completely full after only a few bites of dinner? Something you probably just brushed off as indigestion? What if I told you that quiet little nudge from your body wasn't so little? What if it was a critical warning sign of something far more serious? Something that could genuinely threaten your life? Every year, hundreds of thousands of women across the globe hear the words ovarian cancer. And here's the statistic that should stop us all in our tracks. For every 10 women diagnosed, only about 3 will survive past the 5-year mark. Why is that number so devastatingly low? It's because the early warnings of this disease are masters of disguise. They look and feel like everyday health complaints, so they're often ignored, explained away, or overlooked entirely. But here's the crucial piece of the puzzle, the part that brings hope. That survival rate? It flips, and I mean dramatically flips, when the cancer is caught in its earliest stages. So, what if you could arm yourself with the knowledge to hear its earliest whispers? In this video, we're going to pull back the curtain on 12 research-backed warning signs of ovarian cancer that every woman, and frankly, everyone who loves and cares for a woman, absolutely must know. Some of these are going to surprise you, and one of them, number 7 on our list, is so frequently misunderstood it's often missed until it's dangerously late. Stay with me to the end, because we're also going to talk about how to know when it's time to stop waiting and start acting. Your health is the most valuable thing you will ever own. Let's learn how to protect it. And as we dive in, let me know in the comments where you're watching from today. Your voice is a huge part of what makes this community so powerful. Disclaimer: please remember this video is for educational purposes only and is not a substitute for professional medical advice. Every piece of information we're about to share is backed by verified research, and you can find all the sources linked in the description below. All right, let's get into the critical signs that demand your attention. Number 1, the bloat that won't go away. Okay, let's be honest. We've all felt bloated. After a big holiday meal or during that time of the month, it's normal. But this isn't that. This is different. This is a persistent, stubborn, day in, day out pressure and tightness in your abdomen. It's the kind of bloating that doesn't leave when your cycle ends or after a healthy meal. It's a guest that overstays its welcome. This feeling is one of the most common first signals of ovarian cancer. And according to the Ovarian Cancer Research Alliance, it's not just a vague feeling. It's often caused by something called ascites, a buildup of fluid in the abdomen, which is a telltale sign as the disease progresses. So the key takeaway is this. If your belly feels constantly swollen or full for more than 2 or 3 weeks, especially if it's a new feeling for you, it's time to talk to a doctor. Early detection is everything. Number 2, that nagging pain in your pelvis or abdomen. You know your body better than anyone. You know its normal aches and rhythms. So when a new and persistent discomfort sets up shop deep in your pelvis or lower stomach and just refuses to leave, your body is trying to tell you something. This isn't necessarily a sharp, dramatic pain. It could be a dull, nagging ache, a constant feeling of pressure, or even sharp pains that come and go. It's so easy to blame it on period cramps or something you ate. But here's the difference. If it's happening almost every day for several weeks, it's no longer normal. With ovarian cancer, this pain is often the result of a tumor literally pressing on nearby organs and nerves. The American Cancer Society is very clear on this. Pain that is new for you and occurs on most days for more than a few weeks is a signal that requires medical attention. Don't dismiss it. Number 3, feeling full way too fast. Picture this. You're starving. You sit down to your favorite meal, You take a few bites, and you're done. Completely stuffed. It's frustrating, right? This feeling, known as early satiety, can feel like a small annoyance, but it's a huge clue. Think of it this way. When a tumor grows in the abdominal cavity, it's like an uninvited guest in a crowded room. It starts taking up space, putting pressure on your stomach and other organs. This pressure physically limits your stomach's ability to expand, which tricks your brain into thinking you're full long before you actually are. The Mayo Clinic confirms that this feeling of fullness, especially when it shows up alongside bloating, is one of the most consistent symptom patterns women report before their diagnosis. If you can't finish your meals like you used to, it's not just a shrinking appetite. It could be a physical sign. Number 4. Sudden changes in your bathroom habits. Urgency, frequency. Suddenly feeling like you have to pee all the time? You might chalk it up to drinking more water or just a sensitive bladder. But if this change comes out of nowhere and sticks around, here's a quick anatomy lesson. Your ovaries are located right next to your bladder. They're neighbors. As a tumor grows on an ovary, it can start to physically push on the bladder. This constant pressure reduces the bladder's capacity and creates that non-stop feeling of urgency, making you run to the bathroom even when there's barely anything there. A major review in the British Medical Journal found a strong link between the sudden onset of these urinary symptoms and an ovarian cancer diagnosis. The key is to differentiate it from a typical UTI. If it lasts and there's no burning, get it checked out. Number 5. A bone-deep fatigue that sleep can't fix. We're not talking about being tired after a long week. This is different. This is a profound, soul-crushing exhaustion that a full night's sleep doesn't even touch. It's a fatigue that makes simple daily tasks feel like climbing a mountain. For many women, this deep weariness is one of the first signs that something is seriously wrong. The body is smart. It recognizes the cancer as an invader and launches an inflammatory response, releasing chemicals called cytokines that can lead to overwhelming fatigue. Research published in the journal Cancer shows that this isn't just in your head. Cancer-related fatigue is biologically different from normal tiredness. If you've been feeling an unusual and persistent lack of energy for weeks on end with no good reason, listen to your body. It's sending up a flare. Number 6. Pain during intimacy. This is a tough one to talk about, but it is so important. Experiencing pain during intercourse, medically known as Dyspareunia, and being told it's just stress or hormones is something too many women go through. But this isn't a superficial discomfort. It's often a deep, aching pain felt inside the pelvis during sex. Why? Because tumors can cause the ovaries to swell or press against the uterus, cervix, and surrounding tissues. That pressure and inflammation can make deep penetration incredibly painful. Memorial Sloan Kettering Cancer Center stresses that any new, deep, or persistent pelvic pain during intimacy should never be written off. It's easy to blame it on aging or emotional factors, but if sex has become physically painful, trust what your body is telling you. A simple conversation with your doctor can bring clarity. Number 7. Irregular periods, the big surprise. Okay, this is the one I told you about at the beginning, number 7. And it's a big one because it completely flips a common assumption on its head. If your cycles suddenly go haywire, periods that are heavier, last longer, come more often, or you're spotting between cycles, it's a massive red flag. For years, many believed that irregular cycles, meaning fewer ovulations, might actually protect against ovarian cancer. A 2022 study in gynecologic oncology found that over a third of ovarian cancer patients experience nausea or vomiting before their diagnosis. The most concerning part? These symptoms were often waved away as simple GI issues, leading to critical delays in getting the right care. Number 11. Aching pain in your legs or thighs. Now this next one might make you go, wait, what? Leg pain? It seems completely disconnected, which is why it's so often misdiagnosed as a pulled muscle or sciatica. The pain is typically a deep, persistent ache, sometimes radiating from your lower back down through your thigh. Here's what's happening. A large ovarian tumor can actually compress something called the obturator nerve, a major nerve in your pelvis that runs down into your leg. That pressure causes referred pain. A 2024 case study in the American Journal of Case Reports told the story of a patient whose only symptoms for 2 years were lower back and radiating leg pain. After countless treatments for muscle problems failed, a scan finally revealed the real culprit, a massive ovarian tumor pressing on those nerves. Once the tumor was removed, her leg pain vanished. It's a powerful reminder to think outside the box. Number 12. Unusual vaginal discharge. It can be really easy to ignore subtle changes down there, especially if they don't seem like a big deal. But if you notice a discharge that is persistent, watery, has a foul odor, or is tinged with blood when it's not your period, your body is waving a flag. While this isn't the most common symptom, it's particularly linked to less common types of ovarian tumors. These tumors can sometimes produce hormones that disrupt the normal environment, leading to abnormal secretions. The CDC has emphasized that for some women with early-stage disease, a strange and persistent discharge was the only symptom they had. It just reinforces how critical it is to be in tune with your body's regular patterns. If something is new, persistent, and just doesn't feel right for you, get it checked out. And that brings us to the end of our list. If you've made it this far, thank you. Thank you for investing this time in your health and in this vital knowledge. Remember, being informed is your superpower. It can save your life. Understanding these signs might just make a world of difference for you or for a woman you love. Now, I want to hear from you. Have you or has someone you know ever dealt with any of these symptoms and had them dismissed? Did this video shine a light on something you may have been overlooking? Please share your story or thoughts in the comments. Your experience is valuable, and it could be the one thing that clicks for someone else who needs to hear it. If you found real value in this information, let us know by simply typing "valuable" in the comments. That one word tells us we're on the right track and fuels our mission to create more. And of course, please don't forget to like this video, share it with the women in your life, and subscribe to the channel for more health updates you can trust. Until next time, stay vigilant, stay informed, and take excellent care of yourself. And look out for each other. Well, a groundbreaking study that followed over 15,000 women for 50 years, published in the International Journal of Cancer, found the exact opposite. The results were astonishing. Women with a history of irregular cycles had double the risk of developing ovarian cancer by age 70. By age 77, that risk had almost tripled. The theory now is that the underlying hormonal imbalances that cause the irregularity are a major contributing factor to cancer risk. So if your menstrual pattern has changed and stayed that way, it's time for a serious conversation with your doctor. Number 8. Indigestion or heartburn that just won't quit. That familiar burning in your chest after dinner, or a constant gassy, uncomfortable feeling? We've all reached for the antacids, right? We blame it on pizza, on stress, on anything. But what if that indigestion becomes your new normal? What if it's a daily battle? This is where we need to pay closer attention. A massive research project, the UK Collaborative Trial of Ovarian Cancer Screening, found something crucial. Digestive symptoms like indigestion were reported by a significant number of women with early-stage disease. And here's the kicker. These symptoms were often more common than classic gynecological signs, like abnormal bleeding. This is a perfect example of how easily our body's signals can be misinterpreted. If you're struggling with heartburn that doesn't get better with the usual remedies, it's imperative to look for a deeper cause. Number 9. A swollen abdomen, and it's not weight gain.
You look in the mirror and your waistline is definitely bigger. Your pants are uncomfortably tight, but the number on the scale hasn't really changed. What's going on? This isn't necessarily fat, it could be fluid. As we mentioned earlier, this condition is called ascites. It happens when cancer cells spread to the lining of the abdomen, irritating it and causing the body to produce excess fluid that fills the abdominal cavity. This isn't just a cosmetic issue. It can lead to shortness of breath and a total loss of appetite. A 2015 analysis in Nature Review's Cancer confirmed that the presence of significant ascites is a critical diagnostic marker, often pointing to a more advanced stage of the disease. If you're experiencing this kind of unexplained abdominal swelling, ask your doctor for a pelvic ultrasound. It's a proactive and necessary step. Number 10. Persistent nausea and vomiting. Of all the symptoms, this one often blindsides women the most because it feels completely unrelated to a gynecological problem. It's so easy to dismiss it as a stomach bug, food poisoning, or stress. But when nausea and vomiting linger for days or keep coming back without any clear reason, it's time to connect the dots. As an ovarian tumor grows, it can physically press on the digestive tract, blocking the normal flow of things and leading to chronic nausea or even vomiting.